Hello friends, I am Samruddhi and my topic is oxytocin and other drugs acting on uterus. So today's topic is ergometrin, methyl ergometrin, prostaglandins and uterine relaxant. Moving towards our main topic, let's discuss briefly about uterine stimulants. These are also called oxytocin and abortifacient. These drugs increase uterine motility. They primarily affect on endometrium and myometrium. Moving towards its classification, it includes four categories. First, posterior pituitary hormones, second, ergot alkaloids, third, prostaglandins, and fourth, miscellaneous drugs. First category includes oxytocin, second includes ergometrin, methyl ergometrin, third includes dinoprost, dinoproston, and carboprost, fourth includes ethacridine, quinine. Moving toward our main topic, ergometrin and methyl ergometrin. These are ergot alkaloids obtained from ergot fungus Claviceps purpura. Methyl ergometrin, it is a derivative of ergometrin. Moving towards its pharmacokinetic. They are rapidly or completely absorbed by oral route. Onset of action, orally it is start action in 15 minutes, intramuscularly in 5 minutes, and IV it acts immediately. It is partly metabolized in the body and excreted in urine. Its plasma half-life is 1 to 2 hours. Moving towards its mechanism of action, it is partial agonist on the 5-HT2 and alpha adrenergic receptor. Moving towards its pharmacological action. First action on uterus. It is highly sensitive at a term and in early puerperal period. It increases force, frequency, duration of uterine contraction. At low doses, contraction and with phasic relaxation in between occurs. At high doses, resting muscle tone also increased, so contracture occurs. Stimulant action involves upper as well as lower segment of the uterus. Second, on CVS, it is weaker vasoconstrictor, not so significantly act at obstetric doses. On CNS, no overt effect at usual doses. GIT only at high doses, it increases peristalsis. Moving towards uses, its primary indication is in PPH, means postpartum hemorrhage. It is used to control and prevent postpartum hemorrhage at dose 0.2 to 0.3 mg by intramuscular route. Action, it causes sustained tonic uterine contraction, which causes uterine arteries compressed and stop bleeding. After caesarean section, it is also used to control and prevent uterine atony. These are also used in normal evolution. Fourth use, it is also used as for diagnosis of variant angina. Adverse effect, it is less toxic than ergotamine, but occasionally it causes nausea, vomiting, and increased BP. At high doses, it decreases milk secretion by its action on the dopamine receptor. Contraindications, during pregnancy and before third stage of labor, it is contraindicated. It is also contraindicated in patients with hypertension and vascular disease. It also contraindicated in sepsis cases because it can cause gangrene in that patient due to the vasoconstrictor effect. It is also contraindicated in liver and kidney diseases. Moving towards our next category, prostaglandins. It includes dinoproston, dinoprost, and carboprost, which are potent uterine stimulants. They act mainly in later part of pregnancy. Action, it causes cervical priming. Cervical ripening at the time of delivery and abortion, it is facilitated by prostaglandins. Second, luteolytic action. They cause structural and functional degradation of corpus luteum. They also inhibit secretion of progesterone. Moving towards its uses at therapeutic abortion, up to the 7th weeks, it is used intravaginally. Uh, Second, cervical priming. Dinoprost makes cervix soft and compliant. Third, postpartum hemorrhage. Carboprost intramuscularly used. Fourth, induction and augmentation of term labor. Dinoprost and dinoproston used. In toxemic and renal failure patients, they do not cause fluid retention. Moving towards uterine relaxant. These are also called tocolytics. These are the drugs which decreases uterine motility. Uses to delay or postpone labor, arrest threaten abortion, and dysmenorrhea. Classification, uterine relaxant are classified into four types. First, adrenergic agonist. Second, calcium channel blockers. Third, oxytocin antagonist. Fourth, miscellaneous drugs. Adrenergic agonist, it includes ridodrine, Salbutamol, calcium channel blockers, it includes nifedipine. Oxytocin antagonist, it includes atosiban. And miscellaneous includes magnesium sulfate, progesterone, nitrates. Adrenergic agonist. Ritodrine. It is a beta-2 selective agonist. It suppresses primary premature labor and delay delivery in cases of some exigency or acute fetal distress. Delivery is postponed in 70% cases by few hours to few weeks. Its adverse effect, it causes metabolic and serious complication. Metabolic, it includes increased insulin level, increased glucose. In CVS, it can include increase heart rate, decrease blood pressure, and it also causes pulmonary edema. It also causes fetal edema, in unit hypoglycemia, and ileus can also cause. Moving towards isofsuprine, it is used to stop threatened abortion. Next, calcium channel blockers. They decrease tone of myometrium and oppose contraction. Nifedipine. It mainly acts on real type of calcium channels. Prominent smooth muscle relaxant property. It can postpone labor if used early. It also has some adverse effects which includes tachycardia, hypotension. Oxytocin antagonist. It includes atosiban. It is only drugs which is oxytocin antagonist. Antagonist at oxytocin receptor. It suppresses premature uterine contraction and postpone preterm delivery. Metabolic and serious complications are less than beta agonist. Magnesium sulfate. Infused IV, first line drug for prevention and treatment of seizure in preeclampsia and eclampsia. Then its tocolytic use. It is used to delay premature labor. Mechanism of action. It competes with calcium channel for entry into myometrium through calcium channels. Moving towards some MCQ, please solve it. Thank you.